My name is Shannon, and in the interest of the qualitative spirit, I want to start by just saying a little bit about myself beyond the things that you can maybe see or have heard Maeve talk about. I am from the US. I'm from Illinois. It's in the middle of the United States. It's a flyover state, would be how many people describe it. So I didn't really grow up in an academic family. I'm the first person in my family to go to graduate school, actually. I did not start in public health right away. I used to be a journalist. And I talk about journalism a lot because it really, really shaped me. And it definitely shaped kind of my bent into the more qualitative and social science elements within public health. If at any point you can't hear me because I have internet connectivity issues, maybe Maeve, if you could send a quick message, or Joanna, if you could even call my phone just in case. But back on this point about being a journalist, it's a career that really taught me the craft of writing and really taught me about the importance of thinking about human connection and storytelling, trying to demonstrate how when I'm interviewing people and talking to them, I need to show them that I care about what they're describing, that I see that there are high stakes, and then I need to give my readers a reason to care about this issue. And so there, I think you can see that a lot of the skills and traits that I see in good qual are also nested within good journalism. I started in public health with the absolute intention of being a trialist, which probably sounds funny to people who know me today. I thought that that's what public health was really all about. Like, I thought public health was saving lives millions at a time. That's the tagline of the university that I studied at. And I thought that you did that by finding the next vitamin A or finding the next best HIV prevention mechanism. And so it's a little bit funny that today I'm here and I can tell you I am very much a qualitative soul. All of my research involves mixed methods. I focus a lot on the design and implementation. In fact, if I were to retitle this presentation, I'd probably call it qualitative and design research in global health interventions. I really enjoy spending a lot of time in communities. I've lived in several of the settings where our work takes place, and I like listening to people describe what their priorities are and what issues matter to them. And then when I'm doing research, I enjoy how within the qualitative spirit, a lot of times things that we don't even think about when we enter into the field become very apparent as we begin data collection, whether that's respect in childbirth, trust related to vaccines, power dynamics related to household choices about child health care seeking. Oftentimes, I find that these things merit a lot more consideration in the context of global health, but we can't necessarily know about them until we've spent a lot of time in the places where our work is taking place. So how do you go from thinking you're going to be this person who's like a micronutrient trialist to being the person who does a lot of design and implementation research in the qualitative spirit? For me, that I refer to this as my adventures with toilets phase. Within my master's degree, we have to collect data and spend a year in the field as part of the master's program that I was a part of. And in this case, I was invited to join a team that had been a part of a 5-year intervention where there were school latrines built throughout Western Kenya. And at Endline, they discovered elevated levels of bacteria on the hands of children in intervention sites. This is obviously a disconcerting finding. And the team had said, we don't really know what's going on. Can you use your journalism, detective, ethnographer thing and try to figure out what this might be about. And that's what I did. You can read the paper. That's the product of this. I spent about 6 months in Nyanza province in Western Kenya. And by virtue of spending a lot of time hanging out on school campuses and listening to teachers and listening to students and listening to data collectors and colleagues talk about their lives and things that are important to them, I also learned about this issue of menstrual hygiene management. And that became the other paper from my master's thesis. I say the other paper because that was not meant to be necessarily a real focal point. It wasn't the issue that we went in thinking was going to be important, but kind of what I just said, right? Where you learn about things that are important, and then you start to learn more and more, and it becomes more compelling to you. And I think readers often sense that. And for that reason, this is to this day one of my most cited papers. I still get phone calls and emails about this paper. And I wasn't necessarily encouraged to lean into that topic or to devote energy to publishing that paper, including by people who I really profoundly respected and continue to respect, but who were of a more quantitative inclination. And I remember meeting one of my public health heroes in the stairwell at a conference, and I told him about this work. And he said, it sounds interesting, but it's probably more of a niche issue, and there's not a lot of funding for it. And this was really disheartening to hear as an early career researcher. And I know he had good intentions in saying that, but I'm also very happy to report that he was wrong, and that it's not a niche issue. Something that's happening to half of humanity is not a niche issue. So that's another point. I'll talk a little bit more about this at the wrap up. But I'm here to say that you might hear qualitative research, does it really have a place? Is there really, could I have a career if I lean into qual? And I can say that yes, you can. These are some of the places that I worked during and shortly after my PhD. It is definitely possible to do great qual and mixed methods research in many settings. Many organizations are looking for evaluators. The challenge that I had was that my career was becoming something that was more about why had a program failed to produce the results that we would have liked? Why are we seeing these things we didn't expect? What were a program's unintended consequences? And those are important things to look into. And a lot of people could be really happy with that. I was a bit frustrated by it, to be honest, because I wanted to be more involved in like not working on issues once the train has left the station, but being a part of the conversation about how we're going to build the train that's going to leave the station. And this is where I want to talk a little bit about the innovation that happened within my career, or which represents something of like a pivot for me. And the innovation basically came because I described this frustration to my then and now current boss, the head of our institute. His name's Till Bernikhausen. And he said, why don't you lean into more of this design research thing? And design research, if you Google it now, you can see all of these different figures. At the time, this would have been, I don't know, 7 or 8 years ago. I wasn't quite sure what he was talking about. So I said, oh yeah, that sounds really good. And then of course you Google furiously. And design research is really about a confluence of engineering and business and art. It has its origin story in ergonomics. But it's really a recognition that a lot of the same tools that we use or that are used when you're designing a mouse for your computer or the cockpit of an airplane can also be valuable tools when you're designing a diagnostic kit, when you're redesigning a health financing program. And this is my, by the way, favorite, sort of my current favorite image that really gets through this process of design research. It involves bringing together multidisciplinary teams. It involves just an explosion of methods. So up until this point, my qualitative methods repertoire was really kind of the bread and butter of qual. And by that, I mean interviews, focus groups, observations. But when you hang around teams that come from fields of art and business and law and theater and education and anthropology and social work and medicine, you learn that there are a lot of other methods that can be used. And I want to highlight this resource. I'll leave this slide open for just a touch longer. It's a free book, by the way, where there are so many more methods that you can pull upon from other fields and that would make a lot of sense in public health and global health. And for myself, I really enjoy thinking about methods. And I think that a part of my methods enthusiasm comes from the fact that I don't think qualitative methods are particularly well, at least when I was going through my master's and doctorate, it felt like it just didn't have the same level of intensity as the quantitative methods that I was taught. And so I enjoy thinking through how can we refine the craft of interviewing. This is one of my favorite papers. And it's a paper where I basically looked at the process that a journalist goes through. You know, every day you collect interviews you don't collect them, you conduct them. And then you come back and you have to talk with your news editor or suite of editors, and they poke holes in your story. Newsrooms are full of this process. This was exactly the process that I went through at all three of the newsrooms that I worked at throughout the United States. And I was really struck when I came into public health that no one seemed to talk about that process as it applies within the health space. So I wrote a chapter in my dissertation that was on this topic. And then we thought, well, maybe if we publish this, like maybe somebody will read it, potentially just my mother, but like maybe more people too. And this paper as well has become rather popular. But another approach that we've noticed is there are a lot of different ways to conduct an interview. And if you come from the field of law versus poli-sci versus anthropology, criminology, they all take really different approaches to an interview. So why in public health are interviews taught in like one way? And could it be that maybe there are other ways to do an interview? And so this was with my colleague Astrid, where we looked at all the different interview styles across different fields. And then we've started to apply those different interview styles in some of our own research. This is a paper where we looked at, okay, we have to do a quick pivot away from the face-to-face because of COVID, and we're going to have to start doing remote interviewing. What's lost and what's gained in that process? And here, very fortunately, we had lots of studies ongoing in many different settings. And so we could kind of piece together some guidance material. And something else that I really enjoy doing is writing down when things don't work and writing down when we think we've got a great method. We think it's going to be just like sparkling out there with the stars, and it just really flops. I think it's a little bit disappointing that academics seem to only want to publish when things are working. And so then mistakes get repeated. And so I encourage colleagues that if we've had a painful learning lesson, like maybe we could avoid a little bit of the funding and frustration that our colleagues might have. But on this methods point, and this is another thing that I learned from the design research field, It feels like traditional qual in global health is also about spoken verbal exchange. And we're really missing out in that respect because a lot of people have a lot to share, but they can't share it via the like almost the theater that's required for me to sit here and talk at like a little dot on the screen. That takes a certain comfort level and practice level. And our society right now is built around people who are really comfortable talking, especially in the English language. And that is so limiting for us in global health. So something that I've gotten really interested in is how can we collect data that doesn't rely on somebody talking to me, that doesn't rely on me asking a sometimes abstract question and expecting someone to just flow for page upon page with all of their insights. How can we use some of these other methods? And here we worked with someone whose background is more in programming, Juliette. How can we pull from some of those methods and then just watch how people are engaging with our products so that we can improve them as we go through this process? And so here's one of our GLOHRA funded projects, I should say, in Uganda, where we were looking at mHealth and developing a new health financing platform. We've also used what's referred to as body storming. This was with my colleague Maya Adam in South Africa. In that case, we noticed with mentor mothers, if we asked them to describe how their messaging was working, how it was going with women, we were getting kind of like short one-word responses. But if we asked them to act it out, we had a full, rich understanding of the challenges that they were facing in terms of using our digital health intervention. In throughout Asia right now, we're doing this approach called shared walks. It's been called transect walks in the past. This is led by Dr. Kate Bernickhausen, where we're walking through the community. It's participant led. We ask if they can show us the different places where humans are interacting with animals. And it's very nice because if I think about it, I might have some ideas about where humans are interacting, but then, oh, yes, right, the bats, right? Or, oh, the chickens. And you can then see things through your respondents' eyes. We've used storyboarding and in the Philippines, drawing together artists, videographers. We've used it as an approach to collect some of the data. But we've also used it as like the prototype for what ended up being our final product from this program, which was called Salubong. This is led by a colleague, Dr. Kati Zangrel. She's using Kamishibai theater. So she's been trying to collect data from young children, kindergartners. And that little black box that you can see down there, she's had children draw out what it means, what heat and nature and the intersection of how heat affects their lives. Excuse me. And then she puts these drawn out figures into the theater box and children sit and talk about it. We've used Lego Serious Play. Actually, we're proposing to use Lego Serious Play to get a sense of where people are going on their pathway for care after an experience of violence. You can also use SAP Scenes. This is free, so apphouse.sap.com, and you can print out scenes. You can tell I get very excited about the methods, so I'm like continuing on the methods thing, but then I'm gonna wrap up soon, I promise. We've used journals and developing journals. And we noticed that there was so little guidance about how to develop a journal that the development of our own journal could have been a little bit better. But in the meantime, this paper it just was published last week. We sought to look at how others had used journals or solicited diaries in their own studies. There were only about a dozen studies that we could find. Majority of them were published just within the last couple of years. So I think this methods enthusiasm and desire to find new methods uh, is not shared by myself exclusively. Document reviews, looking at the tremendous amount of literature that's out there that's saved in the internet and seeing how policies, for instance, get developed and what goes in and what gets taken out of a policy and who's invited to the table to craft or refine that policy and who got left out. We also have a paper that we've published on that relatively recently. So with my last couple minutes, I was thinking about what would be some things that I kind of wish maybe somebody would have told me when I was a little bit earlier in this process. The first thing I wish maybe somebody would have said was that it helps to remain a bit open to to think that as far as topics, as far as method, as far as what is important, what is the value of qualitative research, what is the value of talking with this respondent group, what is the value of looking at that illness issue, it can be very hard. You know, when I just pulled this up today, and I'm looking at some of these papers. This is from my Google Scholar page. I wouldn't have known which ones are going to lead to anybody's interest beyond my mother's, frankly speaking. And it's very, very hard to tell, right? So I started at the top by explaining this menstrual hygiene management issue. And I would just say, if the topic mattered to you, if it mattered to the people who you're living among and collecting data from and listening to, if this thing is keeping you up at night, it matters. So publish it, put it out there. And then if it doesn't matter, maybe it just hasn't hit its right time yet, but maybe it will matter later. And on that point, I think methods matter. Obviously, I've devoted a lot of time to talking about that, but this document analysis paper came about because we noticed our own students wouldn't read the book that we had recommended or the article that we had recommended, which did come from a more political science space. So it was a bit of a different thrust. But we wrote that just so that our own students would have something that they could look at. We did not realize that it was going to become such an important piece. Same for the systematic debriefing paper. So yeah, if it's something that you care about and that it matters to you, then devote your time to it. Like I think that's one piece. Second, when it comes to qualitative research, I really strongly encourage that you engage with theory. I feel like well-theorized qualitative research has greater transferability. It positions the study better in terms of demonstrating how you're building on an existing conversation that's happening in the literature. And it allows you to avoid this sense that I think a lot of readers have when they read atheoretical qualitative literature, which is that it just produces a list. It's basically like half-baked. And by that, I mean, you come up with some codes and then you list out the codes, and people are just less excited, I find, about those papers. And what do I mean by engaging with theory? If you look at some of the papers that come from my group, you'll see what we're talking about. We tend to code the data, and then we look at what's coming out of this data, and then we look into the literature to see, has anybody else written about intra-household bargaining? Has anybody else, if they have, in what way are they writing about it? And then we will always have a paragraph that's somewhere in the methods or somewhere in the theory section of the paper where we show how we're building on the work of others. In this case, it was resilience. We did not think that we were going to be looking at resilience when we were examining the introduction of PrEP in Eswatini, but it came out. And so then we thought, okay, we need to read up on resilience and think about how we might be speaking to that. Same with empowerment. And there we were able to read about some of the beautiful work on empowerment that's really from decades ago, led by Kabir, and then think about what empowerment meant to women in Uganda who were being introduced to self-testing kits, HIV self-testing kits. And final point is to give this process time. You're trying to shed light on messy intersubjective realities. Like it's going to take a while. You're trying oftentimes to bring together people who have disparate understandings. Newer qual methods, especially the ones that I was talking about a lot here, you're going to be engaging with people who are very, very creative, but don't really understand a lot of the research. So they're like, ethics review board, what are you talking about? And that can be kind of tricky. At the same time, you should be in regular touch with someone who could be a mentor and can guide you on when to stop. So because we don't have power calculations, because there isn't a specific moment when you can say that, okay, this was my sample size, it was predetermined, I will now stop. There's more of this reliance on a conversation with somebody who's maybe been through this before and can work with you about some of these timing components. There will oftentimes be some challenges if you're going to take on design research. I think that they're worth overcoming or that they're worth muddling through because the product can be so beautiful. And yes, some of our techniques are excellent. And because they're disarming, they're neutralizing, but they can be a little bit tricky to sell to an ethics or grant reviewer or journal editor or a peer reviewer who will describe it as unscientific or strange. There again, I would just say persevere. We've had so many comments in the last couple of years about like, design research, it's so messy that we've even published a paper, just came out this year, where we write out that yes, it is messy, but that's okay. So here's another resource you can look to. Finally, here are a couple of books that I would say. So along with that design toolkit, I also very much like this Universal Methods of Design. And I really like Yin's book on qualitative methods generally. I'm meant to close with a definition of global health. I thought about this a lot. This is my first time trying to really define it. So if I have to, I'd say global health is a collection of disciplines that collectively aim to deliver messages, materials, or information that can bolster health in a context of disadvantage. For me, it's a lot about delivery and it's a lot about disadvantage. And disadvantage exists everywhere. It transcends borders. In terms of acknowledgements, these are a lot of the different groups that have funded a lot of my work. I have probably forgotten to mention some, but I am nowhere without my team. So I want to close with a photo of them. That's not everybody on the team. We also have men in our team. They were just not there that day. So yeah, that's it. I think now we move to taking some questions. So I will follow your lead, Johanna and Maeve.